Pass your exam with mental health group therapy practice. Question 1. Child Protective Services have removed 10-year-old Christopher from his parents' home due to neglect. Christopher reveals to the nurse that he considers the woman next door his nice mom, that he loves school, and gets above-average grades. The strongest explanation of this response is: Option A, temperament. Option B, genetic factors. Option C, resilience. Option D, paradoxical effects of neglect. The correct answer is option C, resilience. Christopher's positive outlook, strong school performance, and forming a bond with the neighbor indicate resilience. Resilience refers to the ability to adapt and thrive despite facing adversity, such as being. Question 2. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive option A, chlorpromazine, option B, phenelzyme, option C, haloperidol, option D, olanzapine. The correct answer is option D, olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances. Question 3. When should healthcare professionals be most alert to the possibility of communication errors resulting in harm to the patient? Option A, change of shift reports. Option B, admission interviews. Option C, one-to-one conversations with patients. Option D, conversations with patient families. The correct answer is option A, change of shift reports. Healthcare professionals should be most alert to the possibility of communication errors resulting in harm to the patient during change of shift reports. This is a critical time when information is transferred. Question 4. Which medication is commonly prescribed for the treatment of panic disorder? Option A, haloperidol. Option B, clonazepam. Option C, lithium. Option D, fluoxetine. The correct answer is option B, clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous. Question 5. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A, sertraline. Option B, lithium. Option C, clozapine. Option D, haloperidol. The correct answer is option B, lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 6. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A, constantly afraid another student will steal her belongings. Option B, an unusual interest in numbers and specific topics. Option C, demonstrates no interest in athletics or organized sports. Option D, appears more comfortable among males. The correct answer is option B, an unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 7. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A, flashbacks. Option B, nightmares. Option C, hypervigilance. Option D, depression. The correct answer is option B, nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of. Question 8. A patient with bipolar disorder has been prescribed lithium. Which dietary advice is important for the nurse to include? Option A, avoid foods high in tyramine. Option B, maintain a consistent salt intake. Option C, increase protein intake. Option D, avoid foods high in fat. The correct answer is option B, maintain a consistent salt intake. Patients prescribed lithium should maintain a consistent salt intake to prevent fluctuations in lithium levels. Salt intake can impact lithium levels, and sudden changes in salt intake can affect how the body absorbs. Question 9. During a panic attack, what is the nurse's priority intervention for a patient with panic disorder? Option A, encourage the patient to verbalize their feelings. Option B, provide reassurance and stay with the patient. Option C, leave the patient alone to calm down. Option D, distract the patient with a task. The correct answer is option B. Provide reassurance and stay with the patient. During a panic attack, the priority intervention for the nurse is to provide reassurance and stay with the patient. This action helps reduce fear and provides a sense of safety, which can aid in calming the patient. Question 10. A patient with agoraphobia is unable to leave home. Which intervention should the nurse prioritize? Option A. Teach the patient relaxation techniques. Option B. Gradual exposure to feared situations. Option C. Encourage the patient to attend social gatherings. Option D. Provide education about the disorder. The correct answer is option B. Gradual exposure to feared situations. For a patient with agoraphobia, the priority intervention should be gradual exposure to feared situations. This approach helps the patient confront and gradually overcome their fear of leaving home. Common. Question 11. How does emotional trauma typically affect individuals physically? Option A. Emotional trauma is a distinct category and unrelated to physical symptoms. Option B. Physical manifestations of emotional trauma are usually temporary. Option C. Emotional trauma is often manifested as physical symptoms. Option D. Patients are more aware of physical problems caused by trauma. The correct answer is option C. Emotional trauma is often manifested as physical symptoms. 1. Correct answer C. Emotional trauma is often manifested as physical symptoms. When individuals experience emotional trauma, such as severe stress, grief, or abuse, their bodies can respond physically. This. Question 12. When assessing a patient with generalized anxiety disorder, GAD, which symptom would the nurse most likely observe? Option A. Flashbacks. Option B. Excessive worry. Option C. Hallucinations. Option D. Compulsive behaviors. The correct answer is option B. Excessive worry. Excessive worry is a characteristic feature of generalized anxiety disorder GAD. Patients with GAD experience persistent and excessive worry about various aspects of their life, such as work, health, or family. Question 13. A patient with panic disorder is prescribed a benzodiazepine. The nurse should educate the patient that this medication is typically used for: Option A. For long-term maintenance therapy. Option B. As a first-line treatment. Option C. For short-term use due to the risk of dependence. Option D. To treat depression symptoms. The correct answer is option C. For short-term use due to the risk of dependence. The correct answer is C. For short-term use due to the risk of dependence. Benzodiazepines are usually prescribed for short-term relief of anxiety symptoms due to the risk of dependence. Prolonged use can lead to. Question 14. During an admission assessment and interview, which channels of information communication should the nurse be monitoring? Select one that doesn't apply. Option A. Auditory. Option B. Visual. Option C. Written. Option D. Tactile. The correct answer is option C. Written. During an admission assessment and interview, the nurse must actively engage with and monitor multiple communication channels to gather comprehensive patient information. The correct answer is C. Written, as it. Question 15. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A. Hypotension. Option B. Sexual dysfunction. Option C. Increased appetite. Option D. Tachycardia. The correct answer is option B. Sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors, SSRIs. SSRIs can affect sexual function by causing issues, such as decreased libido, delayed. Question 16. A patient with generalized anxiety disorder, GAD, is prescribed escitalopram. The nurse should educate the patient that the full therapeutic effect of this medication may take. Option A. 1 to 2 days. Option B. 1 to 2 weeks. Option C. 2 to 4 weeks. Option D. 6 to 8 weeks. The correct answer is option D. 6 to 8 weeks. Escitalopram, an SSRI used in treating generalized anxiety disorder, typically takes 6 to 8 weeks to achieve its full therapeutic effect. While some improvement may be noticed earlier, the maximum benefit is usually. Question 17. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A. Limited language skills. Option B. Level of cognitive development. Option C. Level of emotional development. Option D. Parental denial that a problem exists. The correct answer is option D. Parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 18. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A. High-protein foods. Option B. High-fiber foods. Option C. Tyramine-rich foods. Option D. Low-fat foods. The correct answer is option C. Tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 19. During a routine health screening, a grieving widow whose husband died 15 months ago reports emptiness, a loss of self, difficulty thinking of the future, and anger at her dead husband. The nurse suggests bereavement counseling. The widow is most likely suffering from Option A. Major depression. Option B. Normal grieving. Option C. Adjustment disorder. Option D. Post-traumatic stress disorder. The correct answer is option C. Adjustment disorder. The widow's symptoms align more closely with an adjustment disorder rather than major depression, normal grieving, or post-traumatic stress disorder. The widow's prolonged struggle in coping with the loss. Question 20. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A. Exposure and response prevention. Option B. Dialectical behavior therapy. Option C. Family therapy. Option D. Interpersonal therapy. The correct answer is option A. Exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 21. When providing care for 10-year-old Harper diagnosed with post-traumatic stress disorder (PTSD), which goal should be addressed initially? Option A. Harper will be able to identify feelings through the use of play therapy. Option B. Harper and her parents will have access to protective resources available through social services. Option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. Option D. Harper and her parents will demonstrate an understanding of the personal human response to traumatic events. The correct answer is option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. The initial goal when caring for a child with PTSD like Harper is to address restoring a sense of control over disturbing thoughts by teaching relaxation techniques. This approach helps the child manage their. Question 22. Why is it important to establish a contract with a client with an eating disorder at the beginning of treatment? Option A. The client and healthcare provider form a partnership that is challenging for the family to disrupt. Option B. A collaborative approach to treatment planning ensures that both physical and emotional needs will be addressed. Option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Option D. Permission for refeeding is crucial as it can have adverse effects. The correct answer is option C. Involving the client in decision-making enhances the feeling of control and fosters cooperation. Establishing a contract with a client with an eating disorder at the start of treatment is crucial to involve the client in decision-making processes. By engaging the client in decision-making, it enhances their. Question 23. Adolescents often display fluctuations in mood along with undeveloped emotional regulation and poor tolerance for frustration. Emotional and behavioral control usually increases over the course of adolescence due to Option A. Limited executive function. Option B. Cerebellum maturation. Option C. Cerebral stasis and hormonal changes. Option D. A slight reduction in brain volume. The correct answer is option B. Cerebellum maturation. Adolescence is marked by significant neurodevelopmental changes that influence emotional regulation and behavioral control. The correct answer, B. Cerebellum maturation, is supported by research showing that the. Question 24. Cognitive behavioral therapy, CBT, is often used to treat which of the following conditions? Option A. Schizophrenia. Option B. Bipolar disorder. Option C. Post-traumatic stress disorder. Option D. Generalized anxiety disorder. The correct answer is option D. Generalized anxiety disorder. Cognitive behavioral therapy (CBT) is a widely used therapeutic approach effective in treating various mental health conditions. While CBT can be beneficial for different disorders, it is particularly well-suited for. Question 25. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case,